And so you go through this, you find out, is that when you got the diagnosis of Lyme disease?
No.
No. Okay.
Because my Western blot test was negative.
Yeah. It can do that, right? It's not exactly
So they
most,
were thinking it was more like a foodborne intoxicant, maybe cross-contamination. Had I been to Mexico, I had 6 months earlier on a cruise. Did I eat lunch meat? Yes, I eat, I had turkey, sushi. Yes. So they were kind of thinking it was more along an intestinal type of thing. And all of my Western blot tests that I would say I had 4 of them over the course of a period of time. Even previous, when they were telling me I was going to that rheumatologist and I was seeing the orthopedic, all those times I was getting tested too. And it's always came back. That evening, and I am not a medical doctor, but please go with me. And I think you'll understand this, right? So I just had a very traumatic experience. Obviously, I have no choice. It's my life. Like I'm going to die if we do not go forward with this procedure. I understand that. After the procedure, they come to me and say that my prenatal workup noted my MMR booster was missing. Now it's like 3:30 in the morning. We just want to go home. And my husband is just, Heather, honey, take that vaccine. That was April 21st of 2016. By December, I was dying. So that evening, I took the MMR booster and we came home and I recovered from the ectopic pregnancy. And then from April progressing to December, my symptoms exploded. I'm talking neurological symptoms. I'm starting to forget words. I can't calculate numbers anymore. I can't drive my vehicle. I'm not recognizing stop signs and street lights. I am profusely vomiting, diarrhea. My fingers are numb. I can't feel my fingers. I'm having night sweats, murderous nightmares, like terror nightmares that I just can't even put into words. I'm exhausted, but I can't sleep. I mean, just the level of symptoms just became so overwhelming that I was just ready to die.
It sounds awful. And, was it something that you brought up to your doctors, clinicians, that, listen, it was after this shot that I started to progressively get worse? Did you bring that up to anybody?
I did. And, that is the unique thing about LLMDs, right? Lyme literate medical doctors. And I'm in the state of Pennsylvania. And if you know anything about Lyme, it's very prevalent in this area. And at that time in 2016, there were only 2 LLMDs in all of Pennsylvania. And one was an older doctor. And I just didn't really jive with his methodology. And then there was another doctor down in Amish country, because the Amish in Pennsylvania really had a run with Lyme. And I went to see this particular medical doctor, and he is the one that enlightened me about this lab out in California called iGenX. And that changed my life. We sent my blood out there, and every single one of those titers popped positive. And then I find out that I have even more complex, that Lyme just isn't Lyme. It comes with some friends. So I had mycoplasma and babesia, which would make sense where they kind of thought I had HIV earlier in the course of my time period because my white blood cell count was so low.
So you get that diagnosis. Do you begin treatment right away to address the Lyme?
Right away.
You do?
Right away. We do a whole plethora of meds. And I understand that doctor was guided by the course that he has to follow. And it's my understanding that the IDAS has a regiment that as soon as you get this test back, if these doctors don't prescribe in the format that is being required, they could potentially lose their license. And this gentleman was playing the fine line. He was doing antibiotics, but he was also mixing in some holistic things. So he was giving me, malarian-based antibiotics, but then boosting me with like a vitamin C IV, like a Myers cocktail. He was playing it both ways. And that's when I realized that every body is different.
It's hard to come to that realization because most of us are taught.
Well, I was a guinea pig too, right? I had to take, I took 4 different ivermectin. Yes, ivermectin.
Very popular
I took ivermectin, Malarone, Biaxin, and Bactrim. That was my regimen. And I was on that for 16 weeks. And then we did a homeopathic aspect, olive leaf extract, a whole bunch of different things. But, at that point in time, I was so far toxic that my internal organs could no longer sustain that antibiotic regimen. And yes, that may work for some other people, but for my physical anatomy, that was not working. And my pancreas and my liver and my gallbladder were like, no, we're done. And so by the end of that year, and I don't mean to be too dramatic, but I was vomiting what appeared to look like coffee grinds. And then that was when I was rushed to one of our major medical hospitals in this area. Upon arrival to this hospital, they pull my husband aside and tell them that I've ran my course of antibiotics and that what I really needed was a psychotherapist. That women have the tendencies to manifest their symptoms. And if I took my course of antibiotics, then my Lyme is cured. And what I'm going through is just the mental aspects. And she just needs someone to talk to. And that's when I think my husband's eyes opened up to, this isn't the path. If we are healing, this isn't the path we're going down. And he scooped me up out of that ER. And I don't want to say have turned our back on Western medicine, but we no longer do any pharmaceuticals at all.
I mean, listen, your experience guides you to how you're going to, proceed with your life in all choices, all venues. And I have to say, knowing enough patients that have gone through chronic conditions, and a lot of those chronic conditions were exacerbated because they put their trust and all of their, hope and everything into the conventional medicine system. It's not to say it doesn't work, right? It works for some people, not for everyone. Yes. And that's the problem, is that when you get to someone that it isn't working, they start to blame you, not themselves. Yes. That's what I found is ridiculous. It's like going to a financial, advisor, and you give them the money and they're losing it and they're losing it. And they keep losing it, even though with many other, clients, they might make money, but they're doing something different with your money and they're losing it. And you go to them and you say, listen, like something isn't working. They say, it's you, it's you. That's not where. And it's like, well, no, that really can't be. Maybe that's part of the equation, but you have to take responsibility as well. And I think that's where conventional medicine has always lagged so far behind, is to actually appreciate the humanness, the personalization of every single individual, uniqueness of them, and to say, maybe we can't help you, but there's got to be something else out there.